I'm Rosie Auld. I'm the head orthoptist at Birmingham and Midland Eye Centre, and I have a team of 12 orthoptists and 5 ophthalmic technicians.
When you lean your head forward so it's flat against the bar. Lovely.
Development in terms of orthoptic practice has changed quite considerably. When I came into practice 20-30 years ago, I suppose it is now, we were very much seen as being paediatric specialists, so looking after children's eye care.
I'm just going to get the picture now, here we go, keep nice and still.
I think that's changed dramatically over the years, and we're now very much involved in adult care within the acute sector and in the community. In terms of the clinical involvement, I think there's much more emphasis on changing in roles, so the use of assistant practitioners on roles that were traditionally performed by orthoptists in the past, and also then changing the role of more senior clinicians so that they're then taking on roles that were traditionally performed by medical teams.
Just finished the diagnostic tests on Mrs. Murray.
My name's James Flint. I'm the Deputy Head Orthoptist in the Orthoptics Department at the Birmingham Midland Eye Centre. My role as an orthoptist has developed significantly in recent years, particularly in the area of glaucoma specialist care. I'm taking on responsibilities now that would have otherwise been held by the medical staff, and this ultimately has helped patient care and patient throughput. Well, the subject of glaucoma is so broad, and it covers so many different subcategories within it, many of which are incredibly complex and require incredibly complex treatment methodologies from these consultants. These take a lot of time to prepare, and a lot of clinical time is spent with these types of patients. The development of roles such as myself has allowed us to take the patients that are more stable in nature away from the consultants to allow them more time to see those more complex patients.
The orthoptist helps us a lot. They look at the simple cases of glaucoma and thus freeing our time to give to the more complex patients, and also improve the quality of what we do for these complex patients.
It doesn't seem to have progressed in any way since last time we saw you, so I'm fairly happy with how things are going. I don't think we need to see you again probably for another 6 months now. Well, I get a huge amount of satisfaction from thinking that I'm now able and in a position to provide diagnostics to the patient, but also be able to diagnose the patient and then take quite a large role in the decision on the management of that patient also.
In terms of career development, I think the changes that have happened really in the last 5 years have made a significant difference to orthoptists coming through as graduates, because it means that, I suppose, traditionally, instead of going up the managerial route to get promotion, it gives much greater scope in terms of the clinical route to gain promotion, but also to gain expertise and clinical skills that they possibly wouldn't have otherwise had.
My name's Samantha Page. I'm a newly qualified orthoptist at BMIC, so I've just recently graduated from university. I find the fact that the roles develop so much very encouraging, and the extended role for me is something to aspire to, really. I knew quite early on about the extended role, and it was sort of an added incentive really to pursue the career.
I think in terms of role extension, it shows that the sort of training, the sort of skills and competencies that orthoptists as allied health professions have can give greater value to patient care. So, I think it's essential that that's the way forward.